we have a special guest today, Dr. Sushma Bayan, gynecologist, obstetrician also. So a warm welcome to her.
Thank you so much.
Um, just before we continue or we start begin with, it's a small session about what is AVLGI. We will just say what is AVLGI and then we'll get into the subject. So introduction of AVLGI, Arya Vaishya's Ladies Group International, was founded by Mrs. Kavita Ergam with the vision of creating a global platform that unites, empowers and inspires Arya Vaishya women. Under her leadership, AVLGI has grown into one of the largest and most active online communities for Arya Vaishya ladies. Founder and International President, Mrs. Kavita Ergam, Chief Advisory, Dr. Ergam Venkatesh. What began as a Facebook community has now expanded into a thriving global network with over 30,000 members. What is the motto of AVLGI? It's more like tradition yet modern. It's a combination of both, and we say what you have given, right? You will get what you give. So that is the kind of thing. And they have daily unique concepts like the horoscope Monday and entertainment, market day, and so it's a kind of a mixed thing for all of the things. Yeah, and they include two international communities in Singapore and Dubai, and across Karnataka around 20 wings. Yeah, and that's about AVLGI. Now, where are we from? So, if you're wondering, we are more from the AVLGI BTM Kaneka wing. So, AVLGI BTM Kaneka wing was installed in July 2023 under the leadership of Charter President Nagapadma Malini and Madhavi Lata Garu, but unfortunately Nagapadma Malini is not able to join us today. She's kind of busy, and we've had around 70 active members, and we've done a lot of projects, community care projects, and day visit to temples, and awareness with a lot of things. And warm welcome to our chief guest. I think Dr. Sushma Bayan. Here you go. Dr. Sushma Bayan, MBBS, DGO, MS. Obstetrics and Gynecology. Dr. Sushma Bayan is a consultant obstetrician and gynecologist with over 12 years of experience in women's healthcare. She completed her MBBS from Mysore Medical College, followed by a diploma and MS in obstetrics and gynecology in Bengaluru. She has completed a fellowship in minimal access surgery, FMAS. Over the years, Dr. Sushma has worked with leading hospitals in Bengaluru, gaining extensive in obstetrics, gynecology, and women's wellness. She is known for her compassionate approach, evidence-based practice, and commitment to providing high-quality care to women. Warm welcome, and thank you so much for giving us time in the busy schedule also. And just yeah, and just 2 cents about me. This is Meena Praveen, Secretary of AVLGI BTM Kanika Wing, and I'm working as a Senior Product Manager at Motorola with over 20 years plus of work experience. Yeah. And what is the session all about today? So we were going to divide it into 3 different. One is about the when teenage, like they get into the period, the cycle, the hygiene, perimenopause and menopause. I think nowadays a lot of people are kind of stuck with the perimenopause and menopause. So we will touch that. Before we start, doctor, tell us about your journey, about gynecology and obstetrics. It's a really, I'm not able to pronounce the word properly, but it's a great thing. So how was your journey?
Jayavasvi. First of all, I would like to thank AVLGI and also AVLGI BTM wing for the opportunity and to educate all the members of our wing. I will try to talk in Kannada and English. ಸೊ ನನ್ನ ಜರ್ನಿ ಬಂದು ನಾನು MBBS ಮಾಡಿದ್ದು ಮೈಸೂರು ಮೆಡಿಕಲ್ ಕಾಲೇಜಲ್ಲಿ. ನಾನು ಡಾಕ್ಟರ್ ಆಗಬೇಕು ಅಂತ ನಮ್ಮ ಪೇರೆಂಟ್ಸ್ಗೆ ತುಂಬ ಇಷ್ಟ ಇತ್ತು ದ್ಯಾನ್ ಮೀ. ನಮ್ಮಮ್ಮ ಮೈ ಮದರ್ ವಾಂಟೆಡ್ ಮೀ ಟು ಬಿ independent and also to help the society. So she basically, from her inspiration, I took up MBBS. So I did my MBBS from Mysore Medical College. So my MBBS mugmele will be put under training called internship. At time I realized that obstetrics and gynecology, it is a two extreme. One side it is happiness, another side it is suffering of women. Most of the time they doesn't come out. Hesitation irbodu athwa ignorance they will not be aware what is normal or abnormal. Sometimes ಒಂಥರ ಹಿಂಜರಿಕೆ ಮುಜುಗರ ಇರ್ಬೋದು. So one side giving or bringing new life to the world, that joy, one extreme. So to women health improve ಮಾಡಬೇಕು. I have to and also I was interested in surgery. So that is why I took up obstetrics and gynecology as my post graduation subject. I did my obstetrics and gynecology from Bangalore Medical College, and further I wanted to learn more. I did my fellowship in laparoscopy and endoscopy in gynecology. So each day it is learning. Every patient I will be learning new things. So it's a never ending thing. Doctor or this field is never ending. Each day we learn new things.
Perfect.
So I'm very happy that I'm serving womanhood and ಅವರ ಹೆಲ್ತ್ನ ಇಂಪ್ರೂವ್ ಮಾಡೋಕ್ಕೆ ನಾನು ಹೆಲ್ಪ್ ಮಾಡ್ತಿದ್ದೀನಿ ಅಂತ ಐ ಆಮ್ ವೆರಿ ಹ್ಯಾಪಿ ಆ್ಯಂಡ್ ಪ್ರೌಡ್ ಅಬೌಟ್ ದಟ್.
ಥ್ಯಾಂಕ್ ಯು ಸೊ ಮಚ್ ಡಾಕ್ಟರ್. ಇನ್ನೊಂದು ಏನು ಗೊತ್ತಾ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟು, ಅವ್ರು ಹೇಳಿದ್ದು ಅವ್ರ ತಾಯಿಗೆ ಕೈಂಡ್ ಆಫ್ ಡೆಡಿಕೇಟ್ ಮಾಡ್ತೀವಿ. ಅವ್ರು ಶಿ ವಾಂಟೆಡ್ ಹರ್ ಟು ಬಿ ಇಂಡಿಪೆಂಡೆಂಟ್.
Independent and during my when she was giving birth to me, she had little complications. So when I was born, she wanted me to become a doctor.
Oh, great. ನೋಡಿ ಅವರು ಮಾಡಿರೋ ವಿಷನ್ ಯು ಆರ್ ಏಬಲ್ ಟು ಕಂಪ್ಲೀಟ್ ಇಟ್. ದಟ್ಸ್ ಅ ಗ್ರೇಟ್ ಥಿಂಗ್ ಅಲ್ವಾ.
She wanted to serve people. Wanted me to serve
through you. Yeah, very nice, very nice. Perfect. ಈಗ ಆಲ್ಮೋಸ್ಟ್ 10 ವರ್ಷ ಹಿಂದೆ ತಗೊಂಡ್ರೆ ಅವಾಗಿದ್ದಿರೋ ಪ್ರಾಬ್ಲಮ್ಸ್ ವಿಮೆನ್ಗಿನು ಇವಾಗ ನಿಮಗೆ ಬರ್ತಾ ಇರೋ ಪೇಷಂಟ್ಸ್, ವಾಟ್ ಯು ಥಿಂಕ್? ಆರ್ ದ ಪ್ರಾಬ್ಲಮ್ಸ್ ಪ್ರಿಟಿ ಮಚ್ ದ ಸೇಮ್ ಆರ್ ಹ್ಯಾಸ್ ಇಟ್ ಎವಾಲ್ವ್ಡ್?
It has definitely. ಮುಂಚೆ more of like nutrition deficiency, like anemia, or like low birth weight, ಆ ಥರ ಪ್ರಾಬ್ಲಮ್ ಅಥವಾ ಹೈಜೀನ್ ರಿಲೇಟೆಡ್ ಪ್ರಾಬ್ಲಮ್ ಇತ್ತು. ಇವಾಗ ಸಿನ್ಸ್ ಅವೇರ್ನೆಸ್ ಹಸ್ ಇಂಪ್ರೂವ್ಡ್ ಅಂಡ್ ನ್ಯೂಟ್ರಿಷನ್ ಇಸ್ ಇಂಪ್ರೂವ್ಡ್, ಇವಾಗ ಎಕ್ಸ್ಟ್ರೀಮ್ ಅಂಡ್ ಮೋಸ್ಟ್ ಆಫ್ ದೆಮ್ ಆರ್ ಕಮ್ಸ್ ವಿತ್ ಒಬೆಸಿಟಿ, ಇರೆಗ್ಯುಲರ್ ಪೀರಿಯಡ್ಸ್, ಸ್ಟ್ರೆಸ್ ರಿಲೇಟೆಡ್, change in lifestyle. Definitely.
Perfect. Okay, let's deep dive into periods and menstrual cycle. Let's try to understand what is considered as a normal menstrual cycle.
ಸೊ ತುಂಬ ಜನಕ್ಕೆ ಇದು ಅವೇರ್ನೆಸ್ ಇರಲ್ಲ, ವಾಟ್ ಈಸ್ ನಾರ್ಮಲ್ ಆ್ಯಂಡ್ ಅಬ್ನಾರ್ಮಲ್. ಅದು ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್. ನಾರ್ಮಲ್ ಪೀರಿಯಡ್ಸ್ ಯೂಶ್ವಲಿ ಸೈಕಲ್ 21 to 35 ಡೇಸ್ ಇದ್ರೆ ನಾರ್ಮಲ್. ಆ ರೇಂಜಲ್ಲಿ ಬಂದರೆ ಲೆಸ್ ದೆನ್ 21 ಡೇಸ್ ಆರ್ ಮೋರ್ ದೆನ್ 35 ಡೇಸ್ ಸೈಕಲ್ ಬರ್ತಾ ಇದೆ ಅಂದರೆ ದಟ್ ಈಸ್ ಕನ್ಸಿಡರ್ಡ್ ಅಬ್ನಾರ್ಮಲ್. And flow usually 3 to 7 days flow is normal. And the flow should be normal, not too low or too high. Like too low andre scanty, less than 1 pad, or less than 2 days flow. Heavy and then flow for more than 7 days associated with clots. Women is ಗಡ್ಡೆ ತರ ಹೋಗ್ತಾ ಇದೆ. ಒಂದು ಎವ್ರಿ 2 hours 3 hours ಗೆ ಪ್ಯಾಡ್ ಫುಲ್ಲಿ ಸೋಕ್ ಆಗ್ತಾ ಇದೆ. ನೈಟ್ ಎಲ್ಲ ಪ್ಯಾಡ್ ಚೇಂಜ್ ಮಾಡಬೇಕಾಗುತ್ತೆ ಅಂತ. ಅದೆಲ್ಲ ಅಬ್ನಾರ್ಮಲ್. So that is very important. Each woman is different. Menstrual cycle, some will have for 21 days, some will have
21 days. Is it normal when they start menstruating?
Yes,
also? Yes. Oh, okay. And even starting, I mean, as and when teenagers they start menstruating, how much is considered as normal? Andre you ಹೇಳಿದಾಗ 7 to 10 days, okay, but do you think 21 days menstruating is normal?
No, 21 days cycle.
Every cycle is 21 days. So normal
ranges
around
between 21 to 35 days.
Okay.
Every 21 days ಗೂ ಬರ್ಬೋದು, every 35 days ಗೂ ಬರ್ಬೋದು.
Okay.
Below 21 days or above 35 days is abnormal.
Okay, perfect. ಮತ್ತೆ ಈಗ ಆಫ್ ಲೇಟ್ ನೋಡಿರೋದು ಬಂದ್ಬಿಟ್ಟು ಕಿಡ್ಸ್ಗೆ ಐ ಥಿಂಕ್ this generation, maybe I don't know, we have seen so many like Gen Zs and coming up, not only millennial. So what we have seen, they're completely shut off during periods. They don't want, they'll just be in the room, they don't want to speak to anyone, they just don't want to come out. ನನ್ಗೆ ಅದೇ ಅನ್ಸುತ್ತೆ, ನಮ್ಮ ಜನ್ರೇಷನ್ ಎಲ್ಲ ಇದು ತುಂಬ ನಾರ್ಮಲ್ ಆಗಿತ್ತಲ್ಲ, ಈಗ ಏನು ಅಂದರೆ are they not able to tolerate that pain, or I don't know, what do you think? Have you seen that kind of behavior with the new things?
See, mainly nowadays only one kid syndrome is very much pampered.
Just 1 second.
Selfie mode lo vastund. బ్యాక్ సైడ్ ఉల్టా
కరెక్ట్
సెల్ఫీ
ఉల్టా వస్తుంది.
యూట్యూబ్లో ఉల్టా వస్తుంది.
జస్ట్ 1 second.
ఫోన్ పెట్టుకొని నిల్చుకుంటాం లేదంటే
No, this image.
That is 1 second. That is the banner. That's mirror image. But we both are coming correct, no?
That has to come when this one.
But usually banner will come as mirror image. But other faces are coming correct, no?
Yeah.
I'm sorry for the interruption. Yeah, I think we can continue, right? So, Adi, can you aim ಹೇಳ್ತೀರಾ kids?
See, there are two types of pain during periods. One is primary and secondary dysmenorrhea ಅಂತ ಕರಿತೀವಿ ನಾವು ಮೆಡಿಕಲ್ ಟರ್ಮ್ಸ್ ಅಲ್ಲಿ. ಸೊ ಯೂಶುವಲಿ ಆಗೋದು ಪ್ರೈಮರಿ ಅಂದ್ರೆ there is no cause pain because of the uterus is pushing the blood outside, or there is something hormone chemical called prostaglandin ಅಂತ ಪ್ರೊಡ್ಯೂಸ್ ಆಗುತ್ತೆ. ಅವಾಗ ಇರಿಟೇಷನ್ ಆಗುತ್ತೆ. ಬ್ಲಡ್ ಇಟ್ ಸೆಲ್ಫ್ ಇಸ್ ಅ ಇರಿಟೆಂಟ್. ಸೊ ನಾರ್ಮಲಿ ಟೀನೇಜ್ ಅಲ್ಲಿ ಇಟ್ ಇಸ್ ಕಾಲ್ಡ್ ಪ್ರೈಮರಿ ಡಿಸ್ಮೆನೋರಿಯಾ ಆರ್ ಫಿಸಿಯಾಲಜಿಕಲ್ ಮೋಸ್ಟ್ ಲೈಕ್ಲಿ. ಸೊ ದಟ್ ಈಸ್ usually present starts within 2-3 hours before actual onset of period, and present for 1 day or maximum 2 days.
Okay.
So
what is the term again you said, doctor?
Primary dysmenorrhea we call
Okay,
it.
so we
It is
learned
more like a
something new.
physiological. ಅಂದ್ರೆ uterus ಅಲ್ಲಿ problem ಏನೂ ಇಲ್ಲ. Just because the uterus is trying to push the blood out, and also prostaglandin ಅಂತ ಒಂದು chemical produce ಆಗುತ್ತೆ periods time ಅಲ್ಲಿ, that will cause that spasmodic pain ತರ ಹಿಂದಂಗೆ ಪೇನ್ ಬರುತ್ತೆ. ಅಂಡ್ ಬ್ಲಡ್ ಇಟ್ ಸೆಲ್ಫ್ ಬ್ಲಡ್ ಯೂಟ್ರಸ್ ಅಲ್ಲಿ ಇರೋದೇ ಇರಿಟೆಂಟ್ ಆಗುತ್ತೆ. ಅದರಿಂದನೇ ಕೆಲವೊಮ್ಮೆ ಫ್ರೀಕ್ವೆಂಟ್ ಯೂರಿನೇಷನ್ ಆಗ್ತಾ ಇರುತ್ತೆ, ಅಥವಾ ಅಗೇನ್ ಅಂಡ್ ಅಗೇನ್ ಸ್ಟೂಲ್ಸ್ ಪಾಸ್ ಮಾಡಬೇಕು ಅನಿಸ್ತಾ ಇರುತ್ತೆ. ಸೊ ದಟ್ ಈಸ್ ನಾರ್ಮಲ್. ಅಂಡ್ ಈಚ್ perception of pain is different, and especially teenagers, the perception, they are more sensitive towards pain. That is why that teenage girls will experience more of pain. And ಇನ್ನೊಂದು ಏನಂದ್ರೆ they are more of a sedentary lifestyle. They are
maybe ಅವಾಗ ಸ್ವಲ್ಪ ಆಕ್ಟಿವ್
ಆಗಿರ್ಬೇಕು. ಎಸ್ಪೆಷಲಿ ಎವ್ರಿ ಡೇ ಸಮ್ ಅಮೌಂಟ್ ಆಫ್ ಫಿಸಿಕಲ್ ಆಕ್ಟಿವಿಟಿ ಇಸ್ ಮಸ್ಟ್ ಫಾರ್ ಎವ್ರಿಬಡಿ. Because nowadays we are only we are mainly sitting and working in front of system.
Correct.
Or we also in front of patient will sit for hours together. So no physical activity, that also impact our menstrual health.
Even we have seen among the kids also like too much of irregular periods. What are the causes for this irregular periods?
In early menarche, like teenage, ಆಗ ಪೀರಿಯಡ್ ಸ್ಟಾರ್ಟ್ ಆಗಿರೋ ಹುಡುಗಿರ್ಗೆ ಇರೆಗ್ಯುಲರ್ ಇದ್ರೆ ಓಕೆ. ಯಾವಾಗ ಅಬ್ನಾರ್ಮಲ್ ಅಂದ್ರೆ 3 months ಆದ್ರೂ ಪೀರಿಯಡ್ಸ್ ಬರ್ತಾ ಇಲ್ಲ, ಅಥವಾ ತುಂಬಾ ಪ್ರೊಲಾಂಗ್ ಬ್ಲೀಡಿಂಗ್, ಮೋರ್ ದೆನ್ 7 days ಬ್ಲೀಡಿಂಗ್ ಆಗ್ತಿದೆ, ತುಂಬಾ ಕ್ಲಾಟ್ಸ್ ತರ ಪಾಸ್ ಆಗ್ತಾ ಇದೆ ಅಂದ್ರೆ ಇರೆಗ್ಯುಲರ್ ಅಬ್ನಾರ್ಮಾಲಿಟಿ. ಸೊ ಡಾಕ್ಟರ್ನ ಕನ್ಸಲ್ಟ್ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ. ಇರೆಗ್ಯುಲರ್ ಪೀರಿಯಡ್, ಸ್ಕ್ಯಾಂಟಿ ಬ್ಲೀಡಿಂಗ್ ಇನ್ ಫಸ್ಟ್ ಫ್ಯೂ ಮಂತ್ಸ್,
even scanty bleeding also they have to meet
ನಾರ್ಮಲ್. ಬಿಕಾಸ್ ಇಮ್ಮೆಚ್ಯೂರ್ ಇರುತ್ತೆ ಅವ್ರದ್ದು. ಯೂಶಲಿ ಬ್ರೈನ್ ಇಂದ ಕನೆಕ್ಷನ್ ಇರುತ್ತೆ, ವಿ ಕಾಲ್ ಇಟ್ as HPE axis. ಅದು ಇಮ್ಮೆಚ್ಯೂರ್ ಆಗಿರುತ್ತೆ. ಇಟ್ ವಿಲ್ ಟೇಕ್ ಟೈಮ್, ಮೇ ಬಿ 5 years ಆಗುತ್ತೆ. ಸೊ ಮೆನಾರ್ಕ್ ಆಗಿ ಒಂದು 5 years ಸ್ವಲ್ಪ ಇರೆಗ್ಯುಲರ್ ಪೀರಿಯಡ್ಸ್ ಇದ್ರು ಓಕೆ, ಬಟ್ ಇಟ್ ಶುಡ್ ನಾಟ್ ಬಿ ಹೆವಿ ಬ್ಲೀಡಿಂಗ್ ಆರ್ ವೆರಿ ಫ್ರೀಕ್ವೆಂಟ್ ಬ್ಲೀಡಿಂಗ್, so that the girl is losing blood and becoming anemic and weak.
So we have learned so many new things today. Very nice. ಈಗ ಸ್ವಲ್ಪ ಮಿತ್ ಅಂಡ್ ಮಿಸ್ಕನ್ಸೆಪ್ಷನ್. ದೇ ಸೇ ಪೀರಿಯಡ್ಸ್ ಇದ್ದಾಗ ಕೋಲ್ಡ್ ಐಟಮ್ಸ್ ತಿನ್ನಬಾರ್ದು, ಐಸ್ ಕ್ರೀಮ್ಸ್ ತಿನ್ನಬಾರ್ದು, ಕರ್ಡ್ ತಿನ್ನಬಾರ್ದು, ಈ ತರ ತುಂಬಾ ಇದಿದೆ. ಇಸ್ ದಟ್ ರಿಯಲಿ ಟ್ರೂ?
No, that is a myth.
So
usually menstruation time ಅಲ್ಲಿ ಸ್ವಲ್ಪ ಕ್ರೇವಿಂಗ್ಸ್ ಆಗುತ್ತೆ because of hormone changes. Pain in cold weather ಜಾಸ್ತಿ ಆಗುತ್ತೆ. Pain perception, any form of pain, not only menstrual pain, ಸ್ವಲ್ಪ cold weather ಅಲ್ಲಿ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. It is not cold items ತಿನ್ನಬಾರ್ದು.
So it's a myth. Okay, so we learned something new, because we still remember right from when we were kids, they used to always say don't eat cold items, don't eat ice creams during periods. Perfect. Ega, one more thing I think which is in this generation, stress is something that's always high. So do you think because of stress there is a chance of delay in periods?
Yes,
Agata?
definitely. Yeah, agate.
So this is
So
not a
there is,
myth.
yeah, no, it is
Okay,
true.
it is true. Okay.
And we also tell patients
Mhm.
who come with irregular periods to do meditation, adequate sleep, and good.
Whatever age
Yeah,
group.
yeah.
Whatever age group.
Yes,
Okay.
yes. Only if it is extreme, we will tackle
We will
it.
tackle. Okay. Cool.
There is connection between brain and our ovary and uterus. ಸೊ ಬ್ರೈನ್ ಇಂದ ಸಿಗ್ನಲ್ ನಮ್ಮ ಅಂಡಕೋಶಕ್ಕೆ ಹೋಗ್ತಾ ಇರುತ್ತೆ ಓವರೀಸ್, ಅಲ್ಲಿಂದ ಸಿಗ್ನಲ್ ವಿಲ್ ಗೋ ಟು ಯೂಟ್ರಸ್. ವೆನೆವರ್ ದರ್ ಇಸ್ ಎನಿ ಚೇಂಜ್ ಇನ್ ದ ಅವರ್ ಡೇ ಟು ಡೇ ಲೈಫ್, ಸಮ್ ಮೆನ್ಸ್ಟ್ರಲ್ ಅಬ್ನಾರ್ಮಾಲಿಟೀಸ್ ಆಗುತ್ತೆ. ಬಟ್ ಇಫ್ ಇಟ್ ಈಸ್ ಪ್ರೊಲಾಂಗಿಂಗ್ ಫಾರ್ ಮೋರ್ ಡ್ಯೂರೇಷನ್ ದೆನ್ ವಿ ನೀಡ್ ಟು ಇಂಟರ್ವೆನ್.
ಈಗ ಇನ್ನೊಂದು ತುಂಬಾ ಜನ ಕೇಳೋದಂದ್ರೆ ಪೀರಿಯಡ್ಸ್ ಟೈಮಲ್ಲಿ ಎಕ್ಸರ್ಸೈಸ್ ಮಾಡ್ಬೋದಾ? ನಾವು ಚಿಕ್ಕವರಿದ್ದಾಗ ಐ ಥಿಂಕ್ ಇಟ್ ವಾಸ್ ವೆರಿ ಮಚ್ ಟೋಲ್ಡ್ ದಟ್ ನೋ ಫಿಸಿಕಲ್ ಎಕ್ಸರ್ಸೈಸ್ ಡ್ಯೂರಿಂಗ್ periods, but nowadays we see the tendency, even though they have periods, we have see people doing. So
Definitely,
what do you think?
you can do exercise during periods, not high intense
Not
exercise, light
gymming
stretching,
or,
walking, she can do.
Okay.
Especially ನಮಗೆ ಪೀರಿಯಡ್ ಕ್ರಾಂಪ್ ಎಲ್ಲ ಕಮ್ಮಿ ಆಗುತ್ತೆ ಸ್ವಲ್ಪ ಸ್ಟ್ರೆಚಿಂಗ್ ಎಕ್ಸರ್ಸೈಸ್ ಮಾಡೋದ್ರಿಂದ. ಇಟ್ ಇಸ್ ಅ ಮಿತ್ ದಟ್ ಡೂಯಿಂಗ್ ಎಕ್ಸರ್ಸೈಸ್ ವಿಲ್ ಇನ್ಕ್ರೀಸ್ ದ ಫ್ಲೋ.
Correct, exactly. So it's a myth. Okay, good. So we have one more myth here. ಈಗ just to cover the last one in this particular topic. ಈಗ menstrual cups are becoming what to say, too commercial. I don't know whether to use the word commercial, or is it more safer than sanitary pads or tampons? What do you think? In this
Tampon,
three,
sanitary pad or menstrual cycle equally good.
Okay.
Or the use of menstrual
Cups.
products depends upon the
Body.
comfort of the person. So right usage is important.
Okay.
And ಯಾವ್ದಾದ್ರು pad ಅಥವಾ tampon ಅಥವಾ cup, right usage is important.
Perfect. ಇನ್ನೊಂದು ಈಗ ಐ ಥಿಂಕ್ ವಿ ಆರ್ ಆಲ್ ಇನ್ ಮಿಡ್ 40s or mid 30s now. So is there anything that you would like to say, if we had taken ಈಗಿರೋ ಟೀನೇಜರ್ಸ್ಗೆ, if we had taken this, we will not get PCOS later, or we will not, what is it that we can relate? ಏನಾದರೂ ಒಂದು ಟಿಪ್ ಇದೆಯಾ ಆ ಥರ? Anything?
Everything is related to our food and healthy eating and stress-free life.
Okay.
And food, what we are consuming, food and
okay.
physical activity. These three are important for prevention of PCOS or any irregularity, menstrual irregularity.
Okay.
And also that is only the treatment also for PCOS.
So it's healthy lifestyle, food and sleep, physical exercise. Okay.
Stress-free life. Stress will affect everything.
Okay.
Not only one part of the body, it will affect all part of the body.
Okay. So girls over there, kindly listen, and parents, especially moms, when you have teenager girls, right? This something which they have to take care. They take care now will help them in the future. The next 20 years only we can avoid such problems.
The girl should know how to balance life.
Perfect. Thank you, doctor. I think now we'll touch base on perimenopause. So actually, what is perimenopause?
Perimenopause is 5 years or 8, maybe we call it as 3 to 5 years before actual menopause happens.
Okay.
So it ranges from 42 to 48 years. Okay. It is not a strict rule. Each woman it varies. Okay. Some will not experience, some will experience more. Like 5 years and above.
So 5 to 8 years is whatever. Okay. And what age will it usually start? Is there a
42 to 48 years we can
42 to 48. Okay. And can women get pregnant during perimenopause?
Yes, but it is rare because the ovary stop slow down after 40. But yeah, chances are there.
Okay. And what are the earliest signs? As far as I remember, we have always, when we were younger, we've always heard about menopause. I think perimenopause is something that's new, that's coming up. So how do we know if I am in that perimenopause stage? What are the symptoms, early symptoms for that?
Perimenopause also, it is a deficiency of hormones. Ovary ಅಥವಾ ಅಂಡಕೋಶ ಅಂತೀವಲ್ಲ, ಅದು ಸ್ವಲ್ಪ ಸ್ಲೋ ಡೌನ್ ಆಗುತ್ತೆ. ನಮ್ಮ ಹಾರ್ಮೋನ್ಸ್ ಈಸ್ಟ್ರೋಜನ್ ಲೆವೆಲ್ಸ್ ಕಮ್ಮಿ ಆಗುತ್ತೆ. ಸೊ ಯೂಶಲಿ ಫಸ್ಟ್ ಸಿಂಪ್ಟಮ್ ಇಸ್ ಮೆನ್ಸ್ಟ್ರಲ್ ಇರೆಗ್ಯುಲಾರಿಟಿ, delayed flow periods, scanty flow. Some will experience frequent periods. Some very rarely heavy bleeding ಕೂಡ ಆಗುತ್ತೆ. It is all because of hormones.
Okay. ಈಗ ಇದಕ್ಕೆ ಈ ಹಾರ್ಮೋನಲ್ ಥೆರಪಿ, something called HRT is very trending now. So do you think this HRT will help in the perimenopause stage,
First, I would like to tell what is HRT.
Exactly. Yeah. Yes.
ಹಾರ್ಮೋನ್
Please.
ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಥೆರಪಿ ಅಂತೀವಿ ಅದನ್ನ. ಯೂಶಲಿ ನಮ್ಮ ಬಾಡಿಲಿ ಹಾರ್ಮೋನ್ಸ್ ಕಮ್ಮಿ ಆಗ್ತಿದ್ದಂಗೆ ಈಸ್ಟ್ರೋಜನ್ ಹಾರ್ಮೋನ್ ಮೇನ್ಲಿ ಇಟ್ ಇಸ್ ಅ ಫೀಮೇಲ್ ಹಾರ್ಮೋನ್. ಸೊ ಈಸ್ಟ್ರೋಜನ್ ಹಾರ್ಮೋನ್ ಕಮ್ಮಿ ಆಗ್ತಿದ್ದಂಗೆ ನಮಗೆ ಮೆನ್ಸ್ಟ್ರಲ್ ಇರೆಗ್ಯುಲಾರಿಟೀಸ್ ಇಸ್ ಒನ್ ಥಿಂಗ್, ಬಟ್ ನಮ್ಮ ಮೂಡ್ ಸ್ವಿಂಗ್ಸ್ ಆಗ್ತಾ ಇರುತ್ತೆ, ಹಾಟ್ ಫ್ಲಾಶಸ್ ಆಗ್ತಿರುತ್ತೆ, ಬೋನ್ ವಿಲ್ ಬಿಕಮ್ ವೀಕ್.
Okay.
Chances of joint pain, chances of fracture, and estrogen is important for every organ of our body. Like even it protects the heart when it is there. Cholesterol deposit kammi agutte, and it will also maintain the cholesterol level in our body when it is there.
Okay.
So ee tara tumba extreme mood swings, hot flashes ಆಗ್ತಾ ಇದೆ, ಬೋನ್ ವೀಕ್ ಆಗ್ತಿದೆ ಅನ್ನೋರಿಗೆ ಡೆಫಿನೆಟ್ಲಿ ಲೋ ಡೋಸ್ ಆಫ್ ಈಸ್ಟ್ರೋಜನ್ ಅಂಡ್ ಪ್ರೊಜೆಸ್ಟ್ರಾನ್ pill ಕೊಡ್ತೀವಿ ನಾವು, and it is definitely effective, but proper patient selection is important.
Oh, okay. ಈಗ there's something called this internal uterus device, like a Melina insertion. Yes. So is this also part of HRT? Because I think that secretes
mainly
progesterone, right?
Yes.
I think progesterone into the uterus.
Yes. Progesterone is mainly we give for abnormal bleeding or heavy bleeding in the perimenopausal period. It is not used in post-menopause.
Okay.
That is only for heavy bleeding. It is not a part of HRT. HRT is mainly estrogen.
Estrogen. Okay. Okay. So good. So I think we've understood, audience, whoever is listening live. So what is HRT? It's a very important topic. I think
it was
not
there since long, but
long
people
back,
are aware of that now.
ಇವಾಗ ಸ್ವಲ್ಪ ಅದರ ಅವೇರ್ನೆಸ್ ಜಾಸ್ತಿ ಬರ್ತಾ ಇದೆ HRT ಅಂತ ಇದು ಆಗ್ತದೆ. ಮತ್ತೆ ಸೊ ಪೆರಿಮೆನೋಪಾಸ್ ಅಲ್ಲಿ ನೀವು ಹೇಳಿದ ತರ ಮೂಡ್ ಸ್ವಿಂಗ್ಸ್ ವೆರಿ ಕಾಮನ್, ಹಾಟ್ ಫ್ಲಾಶಸ್ ವೆರಿ ಕಾಮನ್, ಸ್ಲೀಪ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇರುತ್ತೆ, ಸ್ಲೀಪ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇರುತ್ತೆ, ಅಂಡ್ ವೆಯ್ಟ್ ಗೇನ್. ಐ ಥಿಂಕ್ ವೆಯ್ಟ್ ಗೇನ್ ಆಲ್ಸೋ.
So estrogen is maintaining our cholesterol level during the reproductive and perimenopausal. ಒಂದ್ಸತಿ estrogen ಕಮ್ಮಿ ಆಗ್ತಂಗೆ cholesterol level alteration ಆಗುತ್ತೆ. So that is why we tell people after 40 to 44 to do exercise. Exercise will help in increasing the bone formation and also maintain cholesterol in our body, prevent obesity, and also help in heart health. Lifestyle is very important.
So based on this, one more question which I will like to relate. ಈಗ strength training in women ಅಂದ್ರೆ lifting weights, gymming is becoming a kind of trend. ಈಗ ಪೆರಿಮೆನೋಪಾಸ್ and menopause stage ಅಲ್ಲಿ ಇರೋರುವೆ ಮಾಡಬಹುದಾ? Is there, or is it like too late, or is that heavy weightlifting will affect contra effect agata atara anta idagutte?
It's never late, but only thing there are chronic osteoarthritis antive, bone related problems, backache, knee pain, and there are certain condition heavy weightlifting ella avoid ಮಾಡಬೇಕಾಗುತ್ತೆ, like hernia ಇರಬಹುದು, like ಸ್ವಲ್ಪ uterus ಕೆಳಗಡೆ ಅದನ್ನ prolapse ಅಂತೀವಿ, ಆ ತರ condition ಅಲ್ಲಿ we tell you can do other form of exercise, not weightlifting. But yes, exercise never it is late, okay, but it should be taken with under proper guidance. You cannot do on your own at home, because in perimenopausal menopausal time the bones will be weak, as I told. So we especially tell women to take calcium rich food and calcium supplement during that time. So you cannot do on your own, it may affect your bone. So always
that was my next question. And supplements necessary, are supplements necessary? So you ಹೇಳ್ತೀರಾ 40 plus ಆದರೆ it's better to go for calcium supplements and multivitamin also, I think, right?
Multivitamins, especially I don't know I should tell or not, we vegetarians are deficient in vitamins.
Exactly. ಮತ್ತೆ ಪ್ರೋಟೀನ್ ಇಂಟೇಕು ಅದೇನಾದ್ರೂ ಹೆಲ್ಪ್ ಆಗುತ್ತಾ? ಡೆಫಿನೆಟ್ ಆಗಿ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ.
It helps in keeping the muscle mass, and also it will keep you full for long, so that junk craving agala, and you don't feel like eating again and again. It will keep you full for long.
ಇನ್ನೊಂದು ಕಾಮನ್ ಕ್ವೆಶನ್ ಅಂದರೆ ಪೀಪಲ್ ಹೂ ಇಸ್ ಪೆರಿಮೆನೋಪಾಸ್ ಹೂ ಇಸ್ ಆಲ್ರೆಡಿ ಫಾಲೋಯಿಂಗ್ ಅ ವೆರಿ ಹೆಲ್ದಿ ಲೈಫ್ ಸ್ಟೈಲ್, ವಾಕಿಂಗ್ ಮಾಡ್ತಾರೆ, ಬಿಫೋರ್ 6 PM 6:30 PM ಒಳಗೆ ಇದು ಮಾಡ್ತಾರೆ, ಯೋಗ 1 hour ಮಾಡ್ತಾರೆ, ಎಲ್ಲ ಮಾಡ್ತಾ ಇರ್ತದೆ, ವೆಯ್ಟ್ ಕಡಿಮೆ ಆಗ್ತಾ ಇಲ್ಲ. ವೈ ಇಸ್ ಇಟ್? ಇಸ್ ದೇರ್ ಅನ್ ಆನ್ಸರ್ ಫಾರ್ ಇಟ್, ಆರ್ ಇಸ್ ದಿಸ್ one of phase
sometimes it happens because of insulin resistance.
Even
in young women also ಎಷ್ಟೇ ನಾವು ವರ್ಕೌಟ್ ಇಟ್ ರಿಕ್ವೈರ್ಸ್ ಪ್ರಾಪರ್ ಇವ್ಯಾಲ್ಯೂಯೇಷನ್ ಟೆಸ್ಟ್ ಎಲ್ಲ ಮಾಡಿ
Okay. Say if they don't have insulin resistance or blood pressure, they're healthy. Then even then, is there something because of perimenopause stage I'm not able to reduce weight?
Definitely after 35-40 years our basal metabolic rate will reduce. So our calorie requirement also reduces. So
so everything back to kitchen. So we have to ensure we have a balanced meal. That's very
basal
important.
metabolic rate reduce ಆಗಿರೋದ್ರಿಂದ ನಮಗೆ ಬಾಡಿ ಬ್ರೇಕ್ ಡೌನ್ ಆಗ್ತಿರಲ್ಲ. ಮೆಟಬಾಲಿಸಮ್ ವಿಲ್ ಬಿ ಸ್ಲೋ. ಆ ತರ ಇದ್ದಾಗ ನಾವು intake.
Yeah. So ladies, proteins we'll have to start if you're not
Calcium
started.
also.
Calcium also, yeah. But I think hot flashes is very common. Why do hot flashes happen? Is there a scientific or biological reason why do hot flashes happen?
Hot flashes is again I'll come back to estrogen deficiency only. ನಮ್ಮ ಬಾಡಿ ಬ್ಲಡ್ ವೆಸಲ್ಸ್ ಎಲ್ಲ ಡೈಲೇಟ್ ಆಗುತ್ತೆ. ಸೊ ಅವಾಗ ಎಲ್ಲರೂ ಸ್ವೆಟರ್ ಹಾಕೊಂಡಿದ್ರೆ ನಾವು ಮಾತ್ರ ಫ್ಯಾನ್ ಹಾಕೊಂಡಿರ್ತೀವಿ.
Correct, exactly.
Again hormone, that is why hormone replacement therapy helps here. And there is certain something called as phytoestrogen. That is estrogen that is naturally present in the food what we eat. Example, soya has broccoli. All this has phytoestrogen. That is natural estrogen. That doesn't have any side effect. That can be consumed.
So soya and broccoli, that is there. Good. Long term only. I think osteoporosis we already touched based. Because of menstrual like the menopause, chances of increase of osteoporosis agata. Okay.
Estrogen is again required for bone strength. So bone, there are two cells, osteoblastic and clastic cells anta. So osteoclastic is bone forming cell. So adella kammi agutte. So adike calcium, vitamin D, exposure to sunlight is very important. And again coming back, doing exercise increases the bone forming cells. That will keep your bone strength. So it should not be suddenly starting in the perimenopausal or menopausal. We have to train our children or the teenagers
muscle mass,
importance of physical exercise. It should start from there. Suddenly if we tell 45-year-old women to do exercise andre kashta agutte. So it should come from before. So that is why
it is a very important message.
We have to make time for ourselves.
Correct.
That is important.
Which we don't in a busy schedule. I think that's where we get stuck. So moms, if you're having teenager kids, or under 20s, so please ensure to tell them why it is important of this routine, so that it will kind of help them for future next 20s and 30s early. Innondu, I think it's a myth, doctor. Menopause aadaga heart, they say no. I mean, when the uterus is removed, maybe not naturally through surgery, the heart, how does it behave? Because usually ಹೇಳ್ತಾರೆ ladies ಗೆ heart attack ಏನಕ್ಕೆ ಕಡಿಮೆ ಅಂದ್ರೆ because of uterus. Is that kind of
because of
ovaries?
So uterus remove ಮಾಡಿದ್ರೆ ovaries function ಆಗ್ತದೆ.
Ovaries function ಆಗುತ್ತೆ. Okay.
So again same thing, hormones ಇಂದನೇ it will maintain the cholesterol deposit ಎಲ್ಲ ಕಮ್ಮಿ ಮಾಡುತ್ತೆ. Blood vessels and cholesterol deposit prevent ಮಾಡುತ್ತೆ. That is why women after 50 increase risk of cardiac problem, heart problem, heart attack ella after 50.
Okay, cool.
So we are blessed basically when compared to men. We are physically and mentally strong.
Correct, perfect. I think menopause alle innondu enandre when you're hitting menopause, it's like a downhill. Everything comes to an end and it's a myth. What do you think? Is it actually a myth or biologically and physically do women actually feel that? No. Menopause ella agoytu anotara.
It is actually myth. It is the people around us telling us. It is beginning of new life, I can tell.
Okay, beginning of new life. Okay, cool. Iga HRT ಬಗ್ಗೆ do you want to give a little more who are the ideal candidates?
So hormone replacement therapy ಮಾಡಿದಾಗ ನಾವು especially when women who has uterus, estrogen progesterone ಎರಡು ಹಾರ್ಮೋನ್ ಇನ್ನ ಲೋ ಡೋಸ್ ಕೊಡ್ತೀವಿ. ಸೊ ಆವಾಗ ಅವರು ಮೆನ್ಸ್ಟ್ರೇಷನ್ ಆಗುತ್ತೆ
ಆಗುತ್ತೆ.
ನಾವು ಬರೀ ಈಸ್ಟ್ರೋಜನ್ ಕೊಟ್ಟಾಗ ಯೂಟ್ರಸ್ಗೆ ಪ್ರಾಬ್ಲಮ್ ಆಗುತ್ತೆ.
ಓಕೆ
There are certain set of people whom we can give no
Okay.
contraindication.
ಓಕೆ
ಸೊ ಯಾರು ಕೊಡಕ್ಕಾಗಲ್ಲ ಅಂದ್ರೆ ಏನೋ ಬ್ರೆಸ್ಟ್ ಲಂಪ್ ಆರ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್, ಲಿವರ್
Okay.
ಡಿಸೀಸ್ ಇದ್ರೆ,
Okay.
ಅಥವಾ ಎನಿ ಕ್ಲಾಟ್ ಫಾರ್ಮಿಂಗ್ ಪ್ರಾಬ್ಲಮ್ ಲೈಕ್
Okay.
ಸ್ಟ್ರೋಕ್.
Yeah.
Because estrogen is increased risk of clot formation.
Oh.
So ಯಾರಿಗಾದ್ರೂ ಡೀಪ್ ವೇನ್ ಥ್ರೋಂಬೋಸಿಸ್ ಅಥವಾ ಸ್ಟ್ರೋಕ್
Okay.
ಆಗಿರೋರಿಗೆ ಅಥವಾ
Okay.
ಲಿವರ್ ಅಂಡ್ ಯೂಟ್ರೈನ್ ರಿಲೇಟೆಡ್ ಯೂಟ್ರೈನ್ ಕ್ಯಾನ್ಸರ್, ಯೂಟ್ರೈನ್ ಹೈಪರ್ಪ್ಲೇಸಿಯಾ ಅಂತೀವಿ, ಅಂದ್ರೆ ಸೆಲ್ಸ್ ಜಾಸ್ತಿ ಗ್ರೋತ್ ಆಗ್ತಾ ಇರುತ್ತೆ.
Okay.
ಆರ್ ಫ್ಯಾಮಿಲಿ ಹಿಸ್ಟ್ರಿ ಆಫ್ ಸಚ್ ಥಿಂಗ್ಸ್ ಆಲ್ಸೋ ಅವರೆಲ್ಲ ಕಾಂಟ್ರಾಇಂಡಿಕೇಟೆಡ್.
Okay.
ಇನ್ನೊಂದು ಹೈಪರ್ ಟೆನ್ಷನ್, ಡಯಾಬಿಟಿಸ್ ಇದ್ರೂ ಕಂಟ್ರೋಲ್ ಅಲ್ಲಿ ಇದ್ರೆ ಕೊಡ್ಬೋದು, ಅನ್ಕಂಟ್ರೋಲ್ ಇದ್ರೆ again we cannot give.
Okay, so it depends a lot on case to
Yeah,
case. Based on the
yes,
blood
yes.
report only, we will start the hormonal therapy. Alla?
And after starting also we will regularly monitor them
Oh,
with ultrasound and blood
Okay.
cholesterol levels, blood
Okay.
sugars,
Blood sugars.
and
Okay.
blood pressure. And all
Because
should
of
be
this,
monitored.
it should not affect the other aspects of the body.
Yes,
Alva?
yes.
Okay, perfect. And is HRT safe?
Again, I told you
The
no,
same thing. Depends
only
from
low risk
low risk.
individual
Individuals.
we can give.
Perfect.
Um,
ಇದರಲ್ಲಿ HRT ಅಲ್ಲಿ biggest myth ಏನು? What have you come across, or what have you seen people having the mindset of ಇದು?
I cannot call it as myth. Increased risk of cancer ಅಂತಾರೆ.
Oh.
It is not real. It is
It's
not
not
true.
proven.
It
It's
is
not-
not. It has risk on endometrial and breast cancer.
Oh, okay.
And but it is safe in ovarian. It will
So there's
prevent
a-
ovarian cancer.
Okay, vice versa. ಈಗ cervix cancer ಬಗ್ಗೆ, is there something that you want to touch base? in terms of the
Cervical cancer is
cervical
not
cancer?
genetically related.
Okay.
Okay, it is by a virus called human papilloma virus.
Okay.
Okay, so and this young infection ಆಗುತ್ತೆ ಅಂದ್ರೆ it is sexually transmitted.
Oh.
Okay, and especially those who have low immunity will have this.
Okay.
So this most of the time the woman will be asymptomatic. ಏನು ಸಿಂಟಮ್ಸೇ ಇರಲ್ಲ ತುಂಬಾ ವರ್ಷ. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ನಾವೀಗ ಏನು ಅಂದ್ರೆ ಸ್ಕ್ರೀನಿಂಗ್ ಮುಂಚೆಯಿಂದ ಇತ್ತು, ಇವಾಗ ವುಮೆನ್ ಆರ್ ಮೋರ್ ಅವೇರ್ ಆಫ್ ದಟ್. ಒನ್ಸ್ ಅ ವುಮೆನ್ ಇಸ್ ಸೆಕ್ಷುಲಿ ಆಕ್ಟಿವ್ ಅಂದ್ರೆ ಮದುವೆ ಆಗಿ 3 years ಇಂದ ಎವ್ರಿ 3 years ನಾವು ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ಸ್ಕ್ರೀನಿಂಗ್ ಪ್ಯಾಪ್ ಟೆಸ್ಟ್ ಅಂತ ಮಾಡ್ತೀವಿ. ಅದು ಪೇನ್ಲೆಸ್ ಅಂಡ್ ಇಟ್ ಇಸ್ ಲೆಸ್ ದೆನ್ 5 minutes ಪ್ರೊಸೀಜರ್. ಸೊ ಎಲ್ಲರೂ ಅದನ್ನ ಹೆದರ್ಕೊಂಡೇ ಮಾಡಲ್ಲ, ಪೇನ್ ಇರಲ್ಲ ಖಂಡಿತ. ಇಟ್ ಇಸ್ ಅ ಪೇನ್ಲೆಸ್ ಪ್ರೊಸೀಜರ್. ಎವ್ರಿ 3 years ಏನಾದ್ರೂ ಸೆಲ್ ಚೇಂಜಸ್ ಇದೆಯಾ, ಅಂಡ್ ಅಲಾಂಗ್ ವಿತ್ ದಟ್ ವಿ ಕ್ಯಾನ್ ವಿಜುವಲೈಸ್ ದ ಸರ್ವಿಕ್ಸ್ ಅಂಡ್ ವಿ ಕ್ಯಾನ್ ಸಿ ವೆದರ್ ಎನಿ ಗ್ರಾಸ್ ಅಬ್ನಾರ್ಮಾಲಿಟಿ ಇದೆಯಾ ಅಂತ. ಸೊ ಇದು ಫಸ್ಟ್ ಡಿಟೆಕ್ಟ್ ಆದ್ರೆ ಸ್ಕ್ರೀನಿಂಗ್ ಇಂದ ಸಿಂಪಲ್ ಪ್ರೊಸೀಜರ್ಸ್ ಆರ್ ಜಸ್ಟ್ ಫಾಲೋ ಅಪ್, ಸಿಂಪಲ್ ಹಿಸ್ಟೆಕ್ಟಮಿ, ಯೂಟ್ರಸ್ ರಿಮೂವ್ ಮಾಡೋದ್ರಿಂದ ಫರ್ದರ್ ಸ್ಪ್ರೆಡ್ ಅವಾಯ್ಡ್ ಮಾಡ್ಬೋದು ಅಂಡ್ ಇನ್ಕ್ರೀಸ್ ದ ಲಾಂಜಿಟಿವಿಟಿ ಆಫ್ ಲೈಫ್.
ಈಗ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಅವೇರ್ನೆಸ್ ಜಾಸ್ತಿ ಬರ್ತದೆ. ಡು ಯು ಥಿಂಕ್ ಇಟ್ಸ್ ಕ್ವೈಟ್ ಎಫೆಕ್ಟಿವ್? 2 doses after a certain age and below certain age, 1 dose?
It's a good question. Because ಎಲ್ಲರೂ ಇವಾಗ the ideal age is 9 to 18 years.
9 to 18 before they are sexually active.
Yeah, before they are sexual, but it can be given up to 45 years.
Okay.
Okay, one sexually active pap smear ಮಾಡ್ತೀವಿ, ನೆಗೆಟಿವ್ ಇದ್ರೆ
Okay.
ಕೊಡ್ಬೋದು. ಲೆಸ್ ದೆನ್ 16 years ಆದ್ರೆ 2 doses.
2 doses.
Okay, and more than 16 years ಆದ್ರೆ 3 doses.
Okay.
So even with HPV vaccine, screening is mandatory. Pap
Okay.
smear testing is mandatory.
Okay.
It is as effective as 88 to 90% to prevent cervical cancer, and also prevents genital warts in the. It is not confined to only female. Even boys can take. It will prevent from penile cancers and penile warts.
Okay.
So,
Okay. Perfect.
and the government of India is giving free of
Free.
cost, less than 16 years 2
ಹೌದಾ?
doses.
Oh.
So,
Because ಇದು ಗೊತ್ತಿರಲಿಲ್ಲ. I've seen
everybody
this
should
most
make
in
use
US
of
and
it.
Canada,
Yeah.
where they give this vaccines for free.
Now,
ಇಂಡಿಯಾದಲ್ಲಿ
ಈಗ recent
recent
3 months
ಆಗಿದೆ.
they have started.
Oh, very
All
nice.
government hospitals
Okay.
less than 16 years 2 doses ಕೊಡ್ತಾ
2
ಇದ್ದಾರೆ.
doses ಕೊಡ್ತಾ ಇದ್ದಾರೆ. So this is one more
So 3
information.
dose ಅಂದ್ರೆ third dose they can take outside
take
if
outside.
required after
Okay.
16 years.
After 16. So see, we didn't know so many things. We are getting to know so many things today, and the government of India great initiative.
And we in India they are setting a manufacture unit, our cost ಎಲ್ಲ reduce ಆಗುತ್ತೆ. Now the cost is pretty high. And 4,000 and 9,000. There are two types of vaccine.
Okay.
So if they set a manufacturing unit here, it is under trial now. Once trial is done, the price will come down.
Okay.
So,
Cool. ಈಗ ಮೇ ಬಿ ಒನ್ ಮೋರ್ ಇದು ನಾಟ್ ಅಬೌಟ್ cervical cancer. Even if a woman feels that she's healthy, like there's no lifestyle diseases, how often they have to go and meet a gynecologist?
every 3 years.
Every 3 years. Okay.
One is breast. We have to examine the breast.
Okay.
And self breast examination antide.
Okay.
Female can take examine her breast to see for any changes in the skin, any small lump.
Okay.
And every 2 years or 3 years once the breast x-ray ಮಾಡ್ತೀವಿ, mammograph anta.
Okay.
And one ultrasound to see
Okay.
ovary and uterus, and one pap smear cervix. This completes.
It's complete. So once in 3 years. So 3 years alli negative bantu andre we can wait for the next 3 years. Okay. I think for mostly working ladies it can get covered under the annual checkup insurance. But I think doctor also encourages that every 3 years, even though you think you're healthy, please go meet a gynecologist.
Helps in
It's
early
very important.
detection of any problem.
Okay.
So avagle prevention is better than cure.
Cure.
It
Okay.
is- Screening is that is well done.
Okay, very good. Let's just, I think we'll do a little more on the menopause. Menopause, how do you define? Like perimenopause define ಮಾಡಿದ್ರೆ beautiful ಆಗಿ. What is when do we hit? ಈಗ ಒಬ್ಬರು 6 months periods ಆಗಿಲ್ಲ, 7 months ಅದೇ ಅಂತ menopause, or what is the
So
definition
menopause
menopause?
is retrospective. ಅಂದ್ರೆ
ಅಂದ್ರೆ?
1 year complete ಆಗಿ periods ಆಗಿಲ್ಲ ಅಂದ್ರೆ then we call it as menopause. So
Okay.
6 months periods ಆಗಿಲ್ಲ ಅಂದ್ರೂ we
Uh-huh.
cannot label it as
It as
menopause.
menopause.
If she get periods, it is normal.
Oh.
So for some women it become irregular and then
Uh-huh.
stop.
Okay.
1 year ಆದ್ಮೇಲೆ ಕಂಪ್ಲೀಟ್ ಆಗಿ ಸ್ಟಾಪ್ ಆಗಿ 1 year ಆದ್ಮೇಲೆ ಮತ್ತೆ ಬ್ಲೀಡಿಂಗ್ ಆಯ್ತು ಅಂದ್ರೆ we call it as post menopausal bleeding.
Post menopause 1 year ಆದ್ಮೇಲೆ. Okay.
So 1 year no periods.
No periods. And after that, is there endometrium wall thickness into ಜಾಸ್ತಿ ಆಗತ್ತಾ? So are there any scans that they have to do?
Yeah, that is why I told every 3 years.
3 years. ಈಗ ಅಂದ್ರೆ after the menopause I'm asking. ಈಗ 1 year ಆಯ್ತು ಅವ್ರಿಗೆ ಆಗಿಲ್ಲ, 1.5 year, even after that period also it's important to go and
that is not necessary
Okay.
to have a ultrasound and confirm that
Okay.
woman is in menopause.
oh, okay, there are some blood tests which
No,
can
not necessary.
not necessary. Okay, cool. I think a really good what is that message that you want to give women? Like they ask 5 things. I think you've already given a lot. 5 things ಅಂತ ಇದು ಹೇಳಿದ್ರೆ
So it's for all the 3 age group, teenagers and reproductive and postmenopausal.
Okay.
Teenagers, HPV vaccine, lifestyle.
Okay.
Okay, reproductive ಅಂದ್ರೆ menstrual hygiene is important. Menstrual hygiene and stress.
Okay.
And perimenopausal, taking care of their health, calcium supplement, screening for PAPS, cervical cancer, and also calcium supplement and screening pap smear.
Okay, perfect. So you talk 5 things. Please make a note in your busy schedule. Just ensure that these 5 things is what doctor is kind of telling us.
I would like to tell health of the woman is more important. If a woman is healthy, families will be healthy and society will be healthy. They tell for education, it is same for health also. Usually women will neglect her health, very family and ಮಕ್ಕಳು ಅಂತ ಓಡಾಡ್ತಾ ಇರ್ತಾರೆ. So if a woman is healthy, she can take care of her family in a better way and the society will be healthy. Perfect. I think a doctor is wonderfully told, right? So women out there, it's a kind of message for everyone, not only for you, including me. I think including doctor, everybody is in the same page. Family ಏನ್ ಬಂದ್ರೂ ಎಲ್ಲಾದು ಹೈ ಪ್ರಯಾರಿಟಿ. ಅವ್ರಿಗೆ ಅದು ಮಾಡಬೇಕು, ಇವ್ರಿಗೆ ಇದು ಮಾಡಬೇಕು, ಅದು ಮಾಡಬೇಕು, ಬಟ್ ನಮಗೆ ಏನು ಮಾಡ್ಕೋಬೇಕು ಅದು ಯಾವಾಗಲೂ ಲೀಸ್ಟ್ ಪ್ರಯಾರಿಟಿ ಆಗುತ್ತೆ. ಸೊ ಕೈಂಡ್ಲಿ ಎನ್ಶ್ಯೂರ್ ಇಟ್ಸ್ ಮೋರ್ ಇಂಪಾರ್ಟೆಂಟ್ ಇಫ್ ಇಟ್ ಇಸ್ ಏನಂತಾರೆ to take care. If we are healthy, then we can take care of the whole family. Perfect. Any other thing that you want to touch base, doctor? Last any other topic you think? Yeah. Like maybe I think one thing we covered about the myths and stuff like that.
Again, this is again, I've got some myths, don't get me wrong. This is soy also is not, it should be avoid during menopause or soya.
Soya, it is a phytoestrogen. It contains natural
Natural.
estrogen. It can be taken.
Can be taken.
Yeah,
Okay.
yeah.
Then I don't know
It's a
why
myth.
it's a myth. It's a myth.
Mhm.
Okay. And only calcium supplements alone will it prevent osteoporosis?
Calcium, yeah,
It can.
definitely.
It
Yes,
can.
yes.
So irrespective, whatever is the bone strength, I think for ladies it's better after 40 or what do you suggest? Which age group do you suggest?
After 45, it's
After
important
45.
to take
It's mandatory
calcium.
tablets.
Uh,
Okay. Okay. Perfect.
And one more thing, PCOS, most of the
correct,
teenagers are coming with PCOS.
Okay.
Not all irregular cycles are PCOS.
Mhm.
So PCOS is one of the reason for irregular cycles. Okay.
Okay.
PCOS ಅಂದ್ರೆ ಎಲ್ಲರೂ irregular cycles ಇದೆ ನಮ್ಗೆ
Mhm.
PCOS ಇದೆ ಅಂತ ಎದುರ್ಕೊಂಡು ಬರ್ತಾರೆ.
Okay.
So
Do you want to define what is PCOS?
PCOS is a polycystic ovarian syndrome. Now they are
Mhm.
calling it as PMOS, polyendocrine metabolic ovarian syndrome, and it is mainly a metabolic hormonal
Mhm.
insulin resistance
Okay.
condition. So in that, girl or a woman will have irregular periods. Along with
Mhm.
that, male hormones ಜಾಸ್ತಿ ಆಗಿರುತ್ತೆ.
Okay.
They manifest as with facial hair,
Oh.
abnormal hair in the limbs or in
Okay.
the over the abdomen, and acne.
Okay.
Acne ಜಾಸ್ತಿ ಇರುತ್ತೆ, and hair loss
Okay.
and darkening of the skin. These are all associated symptoms of PCOS.
Okay.
So not all irregular periods is PCOS.
And again, there are fibroids in the uterus. So are they fibroids and PCOS? Are they different?
Yes, it is
And
different.
how is it going to affect fibroids in the ಏನೇನಾಗುತ್ತೆ PCOS in the ಏನೇನಾಗುತ್ತೆ?
Fibroid is different from
Completely different.
yeah
Okay.
PCOS. PCOS is hormonal imbalance.
And that dissolves, I believe, alva?
Yeah, it is reversible.
Reversible. Okay.
With the
Okay.
again treatment and lifestyle
Okay.
changes.
Uh-huh.
Whereas fibroid is benign, it is not a
cancerous thing.
tumor
Okay.
of the uterus.
Okay.
So it is more common uterus related problem. Maybe
Okay.
if 100 women get ultrasound, 45% or 50 women will have fibroid.
Oh.
So it is genetically determined.
Okay.
Okay, and fibroid again, we don't treat all the fibroids. It
Okay.
depends on the size.
Size is
Location.
Location.
And
Okay. Is it in the
symptom.
pipe or in the uterus and things like that?
It is
Okay.
if it is inside the uterus, it will cause symptoms.
Okay.
And woman is willing for pregnancy. So
Oh.
it depends on what she wants
she
to
wants.
treat.
Okay.
And especially when women in perimenopausal
Mhm.
period, if they have noticed any fibroid, we try to manage it medically so
Mhm.
that once she attains menopause, that fibroid size will come down.
Okay.
But we have to make sure about the diagnosis that it is fibroid.
Oh. Okay.
Because
Okay.
fibroid is not a cancer,
Not a cancer.
that it will increase or spread.
Okay. Okay. Cool. I think we've covered most of the topics. Yeah, I think we should be good. Anything else? I think you've already given a great message for all the women out there. I think thank you so much,
Thank you for
Doctor.
the
Thanks for your time.
opportunity, and
Thank you.
Yeah. Thanks for the opportunity, AVLGI and AVLGI BTM wing.
Yes.
Thank you. Just end the session.